So thank you for both making the time to be here. And why did you want to publish your ideas with Context Magazine?
I think the stylistic conventions of the publication have a way of inviting readers into the intellectual conversation rather than writing for a readership of people who are already really confidently well immersed into it. And secondly, at the same time, well, we're talking about the way that context speaks to non-professional sociological audiences. It also speaks to professional sociologists quite a bit because I've never received as much feedback from other sociologists that I don't already know, that I'm not already connected to, as I have in response to pieces that I've published in context.
So could you walk me through the main argument? What's the key takeaway that you like from this, that you like the readers to take away from your piece?
In our particular example for this article, what we're critiquing is not just the guideline from the USPSTF, the US Preventive Services Task Force guideline for counseling patients around skin cancer risks, which is the topic of the piece. It's not just critiquing the guideline itself, but also the broader processes that led to the guideline to be created in that way. So the guideline instructs physicians to only provide risk counseling, behavioral counseling about how to reduce your risks for skin cancer to individuals with fair skin types. So right away, anyone who doesn't have a fair skin type is not being provided with any information about how to reduce the risks of skin cancer. And when we look at health outcomes for skin cancer, what we find is that for individuals diagnosed with skin cancer, disproportionately, Black patients are diagnosed at a later stage in the disease's progression. We know that earlier detection improves health outcomes. So Black patients are being diagnosed later. And their 5-year survival rate of skin cancer is significantly lower than that of white patients. So we know that with the mortality rate being disproportionate, that there needs to be something done on the other end around risk and around prevention and around screening. But unfortunately, there's not enough research that has focused on individuals with dark skin in the canon of medical research focused on skin cancer for them to be able to draw guideline guidance, right? So if there is not enough evidence-based research on a subject, you can't make a guideline about it. So we have this gap. So it's not as though there's one set of prevention guidelines for people with fair skin and one for people with darker skin types. It's just for fair skin, and there's nothing for people with darker skin types. And that leaves that population of individuals who are disproportionately likely to be racially classified as Black. That leaves that population of individuals not only underserved, but really at higher risk for negative outcomes.
So how do you think your ideas are relevant for the broader public, Jerry?
In medicine, a term that's thrown around quite a bit is the medical care team, and so it involves your physician, nursing, social work, subspecialists, consults, but central to this team is the patient, it's you. And that's a very important point, in that, when deciding what to do next, there are standards of care, oftentimes there are various avenues that can be taken, but ultimately the decision that's made has to be, an agreement between the physician and the patient. And so that's key because you're an integral part of that team. We're all working for you in a way that's best for you. But in that regard, I feel like, in many other aspects of life, people feel like they have choices, and they feel like they're better able to understand what's going on, or they have more resources. If you're buying a house, if you're buying a car, if you're trying to choose a bank. Whereas with, issues of science and medicine, I think oftentimes, patients feel as though they don't have a choice, and that, it's such a foreign subject that's way over their heads and out of their reach that they have really no choice, and no choice but to accept what the doctor is telling them and what the guidelines are, as though these are things that are set in stone, you know. But I think something that we wanted to sort of put forward with this work is to really try to expose that, yes, we have guidelines, you know, that are derived from hard studies and data, but the data comes from somewhere, you know. And so in that regard, it's not perfect. And these things are subject to change, and it's worth questioning them, you know, so that it best suits the patients, you know. And the more data that we have, the better we can inform these guidelines to better care for people.